Greetings, this is Pink Frock Yellow Boots from Behavior, working towards achieving holistic health for everybody. When we speak of anxiety, it is something that everyone faces from time to time in their life. Anxiety is a common thing and helpful in situations that need motivation, that need performance. But when it starts hampering your regular day to day functions and giving your best, it becomes a concern, it becomes a disorder that needs to be given special importance and dealt with to return back to the normal functioning. Symptoms of anxiety could be a fast heart rate, rapid breathing, sweating, brain fogging, cold hands and feet, dissociation, that is detaching yourself from the situation. Zoning out is something that is used in term of dissociating. Also tiredness, fatigue, muscle cramps, pains, aches that you suffer that hamper you from doing anything in that moment when you are triggered. Difficulty eating or having a low appetite or frequent urination. When we see such things happening, it is important to have a self awareness. If not in that moment, later on in time, when you retrospect on what happened, the best method to understand if there is anxiety is to have a self awareness that what actually happened in that situation or moment when things weren't working for you. There could be a lot of triggers that trigger anxiety, but it can also be genetic, and there is no specific starting point of where the anxiety started, which can be pointed out. A lot of triggers could be out of side effects of medications, mental condition, physical condition, social situations that lead to anxiety, relationship issues such as quarrels, abandonment issues, lack of understanding, arguments. It can also be led by substance abuse, that is, drinking, smoking, or taking drugs. A trigger that might remind you of a past abuse or trauma. Also, it is very prevalent in PTSD cases. Anxiety can also be a comorbid with any other physical illness or mental illness, a situation that puts a lot of pressure to function through it might also be a leading cause of anxiety. Getting through anxiety is something that you will find difficult in that moment when the anxiety kicks in, simply because it is not as simple as it sounds. Anxiety is a medical condition, specifically when it becomes impairing to the person going through it. That is why therapeutic professional help is available and has been created because it could be that hampering, that impairing. It is easier to be mindful, to be aware when you start retrospecting and understanding the situations, even if it is after the anxiety has subsided. When you start having an awareness of what you go through during that period, when you retrospect, it becomes more easier to understand what you went through. Most of the time, when it is in the mild stage, you can ground yourself, you can come back to the functional reality, check your facts of what is worrying you, what is causing fear to you, and if it is something that is present, that is factual. Breathing helps. There could be a count based breathing that will help you get through the mild anxiety phase and bring yourself to the current reality. Also, there are other grounding techniques like touching five things, seeing four things, hearing three things, smelling two things, or tasting one thing. That helps you to come back to stop your thoughts, stop that worry, that fear that something might go wrong, or something might not be right, or this might not work out for you. All these techniques are technically telling you to come back to the reality, come back to the actual factual situation. But it might not be that simple for everybody. When anxiety triggers, it might lead you to a situation of brain fog where you don't understand things, you don't know what to do, you become restless. And in that moment, having somebody you can lean on, some friend or a therapist who will help you get through it, is important. Which happens when you have created and built that relationship. Anxiety is not as simple as it seems. It is something very mental, very severe, because there are neurotransmitters that are causing you to function in a certain way that is not helpful. So, when you seek help, when you go for a credible way to deal with it, it is more helpful. It is important that you stick to the course that your psychiatrist and psychologist suggest, because that is by far the most helpful thing. A lot of time it is important to take anti anxiety medicines because they would help the neurotransmitters to come back to a level where they become helpful again, rather than causing a dysfunction, a irregularity in your normal functioning. Therapeutically, when you seek therapeutic help, it is going to make you understand better of how your anxiety function and what are the primary things that you can do to get through your anxiety. It isn't something as simple that you could deal with by yourself or help of people around you. It is something that needs professional help. If it could have been that easy, we wouldn't have been having such a troubled time dealing with it. Reach out to people who would be effective in helping you get through it. Have a safe week ahead. Have a nice time.